Today we are exploring a groundbreaking approach in mental health care. Yes, using the least restrictive practice. Welcome to Growth with Joyce. I hope our week has been going okay. With the future, confidence in action. Imagine a system that prioritizes your autonomy, trust, and personal comfort at every step. Please subscribe, like, comment, and share. This shift empowers individuals to take an active role in their healing journey, fostering a sense of control and respect their traditional methods. Leave a comment if you practice this. Thank you. In this approach, mental health professionals act more as partners than authorities, collaboratively to find way that truly works for us. Techniques like open dialogue, peer support, and personalized care plans are at the forefront. Yes, it is. It's about creating a safe place. We must take this into consideration before any approach. Non-judgmental space where your voice is heard and your experience shape your treatment. So if it's something you do in your community, please leave a comment. By reducing unnecessary restrictions like rigid protocols or excessive medication, we open the door to more humane and effective care. This method recognizes that recovery isn't one size fits all. Instead, it emphasizes flexibility, consent, and dignity, helping people to connect with their strength, and resilience. Please, have you subscribed yet? Please do subscribe. Thank you. Ultimately, embracing the least restrictive practice in mental health care can lead to more genuine, empowering, and lasting healing. Because when care respects your rights and individuality, everyone has a better chance to thrive. For example, least restrictive practice is good. However, it all depends on the setting sometimes. Because, for instance, if you assess a patient and the patient doesn't have a risk of self-harming, there's no need for you to remove the patient's laces. However, their mood can change. So what you do in that instance, let's say it's their first day come for admission, we have what they call 3 days assessment. So that 3 days assessment, during that time, you monitor their physical health, if they are eating, if they are sleeping well, if they are mobilizing well. Then you check their social as well. When you check if they are interacting well, you check all that, both with staff and patients, psychological. That's their behavior. You check all that. If they are manic, if they are calm, if you check all that. If they are aggressive in terms of their risk. So you check all that. So during that 72 hours, and you're able to monitor all that. When they come, you take off their lace, you do everything that you need to do. But within that time, when you know you've assessed them, you can leave their laces or leave whatever you think that shouldn't be with them. Because you've assessed them for that very day, you don't have to be too rigid. But when you know they have history of self-harming, even when they come for that admission and they have laces, you can take it off from them and observe them for days and discuss it with your MDT, multidisciplinary team, to see how you people can work with the patient. So least restrictive practice Then another way is you want for patients to be able to go out and have fresh air. If you are too rigid, it can make them to be aggressive towards staff, towards other patients. So you have to assess everything before you know what to do. When the patient comes in, before the patient comes in for admission, you check why the patient is coming in for admission, why the patient fall ill. Check the past history, check the forensic history, check all this so that you can put plan in place for that patient and manage the patient and give the patient the support that he or she needs during that time. If there is history but the patient is not presenting with any self-harm, you have to work with the past history as well, not just the present. You work with that. You and the other members of staff, you put a plan in place how to support the patients. Least restrictive practice. And also, patients are treated as individual. When you assess patients, you treat them as individual. You don't generalize, because some patients are just there to get some rest, while some are really unwell. So that is why when you are creating their care plan with them, you look for what has worked with them, you ask them what works with them, and you use all that to support them while they are there. So least restrictive practice. It is a good way of caring for patient, but you have to assess the patient, weigh the risk, and put a plan in place. There are some that you have to be restrictive. You work with that, but you cannot generalize, make a general plan for everybody. It's individualized plan. You plan for patients individually. That is how you provide care for patients. If not, if you generalize and say, oh, nobody can have their laces, nobody can have their shoe, nobody can have a drink, nobody can have this at this time, at this time. No, that's not a good way for recovery. So, always assess, weigh the risk before you make a judgment. Because if you generalize, you put a general plan and say this, this is how we do it, this is what we do, it's not a good way for recovery for patients. So make an individualized plan for each patient and work with that. Because some patients will tell you, if it's a patient, some patients will tell you these are the things that works for me, these are the things that don't work for me. So you work with that. So least restrictive practice, it is a good practice, but you must assess the situation, assess the patient, and work as a team to provide a plan for that patient. So, have you subscribed yet? Please subscribe. Thank you so much for listening to me today. Thank you. We the future, confident in action. Thank you. Bye-bye.